Friends, we stand on the final chapter 3 on suicide prevention and coping methods. Please start on positive notes. For example, engage your pain in blogs or writing and start sharing your experiences for people to understand and be aware. At a certain stage of life I myself had started to develop suicide intentions and started to lose hope, and then God helped me and I started this channel, and now, I am starting to enjoy moments of it. Presently I am very busy making videos, collecting information and primarily thinking methods to get genuine subscribers to share my creation. Now, I don't have time for negative things, so start fighting and live for your loved ones. Running away is not worth it. Stand tall and make your family proud. Catch on the rope of hope and start changing. Cheers, and thank you for subscribing this channel and sharing with the ones who need it the most. Please think again, for your family before you think of ending your life. The percentage of patients identified as being at risk for suicide increased by half when all patients were screened, regardless of the cause for their emergency room visit, according to research. More than 3 million additional persons may be at risk for suicide each year, according to the researchers' estimates of the effectiveness of suicide risk screening methods. Therapies and treatments. Help for those who are at risk of suicide is available in the form of efficient, evidence-based therapies. Minimalist interventions. Safety planning. It has been demonstrated that personal safety planning can assist lessen suicidal ideas and deeds. Patients create a plan with their caregiver that outlines how to restrict access to potentially dangerous objects like weapons, medications, or poisons. The plan also includes a list of crisis response personnel, resources, and coping mechanisms. Follow-up phone calls. Studies have indicated that at-risk patients' risk of suicide is reduced when they receive additional screening, a safety plan intervention, and a string of encouraging phone calls. Psychotherapies. It has been discovered that a variety of psychological interventions can benefit those who have tried suicide. These kinds of measures might deter someone from trying again. Cognitive behavioral therapy, CBT, can assist people in discovering new coping mechanisms for stressful situations. When suicidal thoughts occur, CBT enables people to identify their thought patterns and consider other options. Studies have demonstrated that adolescent suicidal conduct is decreased by dialectical behavior therapy, DBT. Adults with borderline personality disorder, a mental disease marked by an ongoing pattern of fluctuating moods, self-image, and behavior that frequently leads to impulsive acts and relationship issues, have also been proven to experience a lower suicide rate when receiving DBT. A therapist who has received DBT training can assist a client in identifying when their thoughts, feelings, or behaviors are unhelpful or disruptive and can teach them coping mechanisms to help them deal with unpleasant circumstances more successfully. You can find a mental health practitioner in your area using the Find Help for Mental Illnesses page. Here are some advice on how to make the most out of your appointment and prepare for discussing your mental health with your healthcare practitioner. Medication. Medication may help certain people who are at suicide risk. In order to determine the optimum drug or pharmaceutical combination, as well as the appropriate dose, healthcare professionals and patients can collaborate. People may benefit from medicine in addition to psychosocial intervention because many people who are at risk for suicide also frequently have mental illnesses or problems with substances. Antipsychotic drug clozapine is primarily used to treat schizophrenia in patients. It is the only drug with a specific FDA indication for lowering the risk of recurrent suicide conduct in people with schizophrenia or schizoaffective disorder as of right now. If you are given a prescription for a medicine, make sure you speak with your doctor or a pharmacist to ensure you are aware of the risks and advantages of the medications you are taking. Never stop taking a drug without first consulting your doctor. When a medicine is abruptly stopped, symptoms may rebound or get worse. There may also be other unpleasant or even harmful withdrawal effects. Contact your healthcare practitioner as soon as you have any worries regarding side effects. You could require a different drug or a dose adjustment. A team-based approach to mental health care is called collaborative care. To create a treatment plan, a behavioral health care manager will collaborate with the patient, their primary healthcare provider, and mental health professionals. It has been demonstrated that collaborative care is a successful method for treating depression and lowering suicidal thoughts. Current research. Promising research that could help lower suicide rates in the U.S. is supported by NIM. Research is assisting in the development and advancement of viable treatments as well as our ability to recognize those who are at risk for suicide. The best ways to implement suicide prevention and intervention programs in a variety of settings, including the healthcare system, the community, schools, and the justice system, are still being studied by NIM researchers. Thanks for watching and giving your valuable time. Please like, share, comment and subscribe to keep our motivation going. Cheers.